Hello and welcome to Talk to Downtown. My name is Courtney Wood. I'm the Economic Development Director and Marketing Director for the Downtown Stockton Alliance, the 501c6 nonprofit property-based business improvement district serving downtown Stockton. This series is intended to connect our business owners, property owners, visitors, and residents with the organizations, people, and resources which impact our community. Today we have two special guests. We have Gregory Diederich. He is the CEO for Community Medical Centers. And we also have Jennie Rodriguez. She is the Director of Development for Community Medical Centers. I'm very excited to talk to them today about CMC. We'll begin by having our guests share a little bit about their background and how they came to work for CMC. Then I'll go through a list of questions that I've outlined for them. And at the end, we will open it up for viewer questions. So if you do have a question, please type it in as a comment and we will get to it towards the end of the live. And with that, welcome. Thank you guys both for being our guests today. Please, can each of you tell us a little bit about your background and how you came to work for Community Medical Centers?
Good morning, and thank you for the opportunity. Sorry, I'm coming to you on my cell phone right before the session started. My internet dropped, so I apologize for that. But it's Greg. Gregory is my legal name. But I've been with Community Medical Centers right at 18 months now. It's an outstanding opportunity. Prior to that, I served as the director of the San Joaquin County Healthcare Services Agency for 10 years. That's a board of supervisors appointment, but it's a agency that included behavioral health, public health. We did jail medical, pre-hospital transport with the EMS agency, veteran services, public guardian. Stood up the medical examiner's office and also did some HUD and housing and urban development dollars. Prior to that, I was about 7.5 years in Stanislaus County as an associate director within their public health system, working with FQHCs, and have about 30 years full experience within the healthcare sector, about 18 of those in the public health space.
Wow, so quite extensive experience in public health. Wonderful. Thank you, Greg. And Jennie, tell us a little bit about yourself.
So I have been with Community Medical Center since 2019. I joined initially as the grants manager responsible for preparing new grants and managing the grants that we received after the fact. And so now I'm development director, which is a new position for me. Well, I've been here for a couple of years, and so, but it is a new kind of endeavor for me. I've never worked in development before, so my goal here is to build up our development department, especially our donor database or our donor base, because that's an area where we need to build up. So prior to that, I came from the collaborative courts, which is part of the San Joaquin Superior Court system. And it is a therapeutic court is another word that they call it. It's a type of court where they send individuals or divert individuals into treatment programs for mental health services, for example, or substance use treatment in lieu of jail incarceration. Mm-hmm. So, and prior to that, I was a journalist for the Record newspaper. So that's where kind of the writing came in.
Very, very interesting combination of your background and kind of how it led to where you are today. Thank you both. Now, can you please tell us a little bit about the background and the mission of Community Medical Centers? What is this organization and what are you guys trying to do?
So Community Medical Centers has been serving Stockton for more than 50 years. We were founded on the simple but important belief that healthcare is not a privilege. What really began as a volunteer effort to provide care to migrant and seasonal workers has grown into one of the region's largest community health care organizations. Our mission is working together to improve health and well-being in our communities. That language is intentional. Healthcare is not something that happens really in isolation. It requires partnerships with patients, families, schools, community organizations, local government. Really all the people who make the community function. As a federally qualified health center, or what FQHC for short, we exist specifically to ensure that people can access care regardless of income, insurance status, language, or their individual circumstances. We serve everybody in the community that has a need. Over the years, our work has really evolved alongside the needs of the community. Today, that means not only primary medical care, but also dental, behavioral health, and substance use treatment services. And we approach healthcare holistically because physical health, mental health, and life circumstances are all really deeply interconnected.
Beautiful. What a beautiful mission. And you touched a little bit on some of the things that you guys offer. Can you kind of give us a big picture perspective of the types of programs and services that are available through community medical centers?
Sure. So CMC provides a broad continuum of integrated healthcare and supportive services. Broadly speaking, these are medical care, which is adult adolescent health services, pediatrics, specialty care services, women's health, also general dentistry, which is dental exams and screening, regular and deep cleanings, fillings, extractions, and treatment. We also do behavioral health, which is counseling for adults, children, families, and adolescents, substance use disorder treatment services, which includes case management. We also have adult and adolescent psychiatry services, so that's something that's somewhat unique within our setting. But then also there's a lot of supportive services having to do with HIV and hepatitis C testing, treatment, and prevention. We have a women, infants, and children's program. We have comprehensive pregnancy care. We have a healthcare for the homeless, which is providing services at shelters and on the street, healthcare counseling, pharmacy, and lab. But really want to integrate. This is all, or emphasize that this is all integrated care because physical health, behavioral health, and social conditions are all deeply interconnected. So, the healthcare system historically has separated those things into silos. And we believe that patients don't experience their life in silos, and it's best to come into somewhat of a one-stop shop, if you will.
100%. That makes perfect sense. Our lives, have so many facets to them, and we're one person experiencing all of them and needing help in multiple areas. So you talked at the start of what you were sharing about the mission, that this is for everyone. So who can access your services? What are the qualifications? Do you need to have, maybe no insurance, or do you need insurance? How does it work? Yeah.
So we provide access to anyone here at CMC, but primarily we serve patients with Medi-Cal, which is California's branding of the federal Medicaid system, as well as Medicare, which is, generally people over 65 are disabled. Those are our two core areas. I think that makes up probably 98% of the patients we see. Maybe that's changing a bit, but we also offer a sliding fee discount program for those that are uninsured or underinsured, and unfortunately, that is now a growing population within the state and our region. But we serve people regardless of their income level. There is a sliding fee discount if you are under 200% of the federal poverty guideline, but community health centers, which CMC is as a federal Department of Healthcare, we remove barriers to care. We don't create new barriers. We serve everybody, and we're proud that we do that. We don't turn anyone away. Obviously, no margin, no mission. So heading in some headwinds, but anybody can seek services here. But it's primarily for the government-funded payers or those without insurance.
Thank you. Thanks for summarizing that. And how can people access your services if they're needing them? What's the best way?
So I think the easiest way is probably just to contact us directly. We have phone numbers, but our website is cmcenters.org. We also have walk-in visits for medical and behavioral health at our East March Lane, as well as Manteca. That's called Care Today for our branding of urgent care, if you will. And people should not delay seeking care because, if they're uncertain about insurance or paperwork, our teams will help you navigate those issues. Contact us directly. As I mentioned, most of our clients are from Medi-Cal, Health Plan of San Joaquin is the local initiative managed care plan. In total, we have about 114,000 assigned lives for Medi-Cal plans, including HealthNet as well as partnership. That's in Solano County. So reach out to us. We have a central scheduling number that I'll have to pull up and promote later. But we're accessible. If you believe you have a need for services or working with coverage counseling, we're here to support you.
Thank you. Thank you for that information. So we've got the website up there. And if someone is currently experiencing a mental or medical health issue and they don't know where to turn, what's a number you might suggest they call?
So if they're in crisis or someone's experienced a medical or psychiatric emergency, they need to call 911 immediately. For mental health crisis or emotional distress that aren't at that severe level, people can call or text 988. That's the National Suicide Crisis Lifeline. But for ongoing healthcare or behavioral support, people can contact CMC locations or visit us directly. Again, our Care Today site at each March Lane, which takes walk-in visits. We also have a mobile community. It's not crisis, but mobile community response. It's primarily for Stockton residents. It's in partnership with the city of Stockton, kind of a quasi alternative to 911. And we have a warm line, and it is 833-311-2273. And this is for individuals with mild to moderate health issues. The county, especially mental health services, county behavioral health services, has a 24/7 services for those with acute mental health needs. And that would be the better route. If you called 988, it's probably going to be going to county mental health services rather than CMC.
Gotcha. Thank you. So I popped up the number there. Does that look right for the 833 number?
Yeah, the crisis line is for whatever reason, area code is 833-311-2273.
Thank you. Thank you so much for that information and resources. Hopefully, if anyone is experiencing something to where they need assistance, that can help them to access services. So you have locations outside of downtown, but like throughout the city of Stockton and in other cities. But at the downtown location, what are the programs that you offer there?
So indeed, we have probably a little bit north of 30 service sites throughout San Joaquin and Solano County, but and Mitty and Stockton, but specifically you asked about downtown Stockton. So at 747 channel, that is downtown Stockton. That is primary care, pediatrics, women's health. Right next door to that at 701 East Channel, that's our residency program. We have a partnership with St. Joseph's Medical Center, and we train their family medicine residents in their ambulatory rotations there. And that offers a full scope of medical. At that location, we also have a pharmacy. We also do some limited imaging by plain film X-ray, but they also offer substance use and mental health services there. Literally right across the street at 201 North Stanislaus Street, that is our respite center. There's kind of two sides to the respite center. One side is a residential for individuals that are going through substance use withdrawal services. They actually will reside there for a length of stay. Part of that, the front part of that building is where we also do some substance use services more on an outpatient basis. Then we also have the Gleason House, which is located at 423 South Stanislaus, probably South San Joaquin Street, next to the Gospel Center Rescue Mission. That location primarily serves the unhoused population or those that might be residing at Gospel Center Rescue Mission, but also open to the community. That is primary medical care as well as case management services. And then also in downtown Stockton, CMC St. Mary's, located at 545 West Sonora Street on the campus of St. Mary's Community Services, formerly known as St. Mary's Dining Hall. But also right at our downtown campus, where Channel and the rest of the center is. We are under construction for our new adolescent health center, which is has been named CMC the Rock. It will serve as a one-stop hub for healthcare services for youth and young adults age 13 to 25. More information about the location of services can be found at our website, but it's under construction. It is kind of a historical building there that we are reconstructing. It should be open, we should finish construction late October or November of this year. And I know Jennie has a lot more probably direct information about the services and some of the focus of some fundraising efforts that we're currently underway.
Thank you. Thanks for giving us kind of a run through of the locations. Can we go back to the 701 location? Just, you have family medicine there, pharmacy, x-ray, substance use, and mental health services. And can you just provide the street name for that one, 701?
Yeah, it's 701. It's our primary Channel campus, and it is 701 East Channel Street. You'll kind of see over time that most of our clinics are named on the street that they reside on. So it's Channel.
It makes it a little easier, doesn't it? Thank you. And you were talking about the new youth center that's being developed. So we're going to talk about that a little bit later on. But can I have the address for that one as well to pop up for people?
Yeah, it's all kind of on the same blocks there. But Jennie, do you know that address off the top of your head?
Not at the top of my head, but I can obtain it right now.
It's not open yet. It's still under construction, but it's literally on the corner there of, I believe, Main and Stanislaus. It's the old Rock Building.
Oh, sorry.
Kitty corner to Ebenezer Church. Yeah, Weber.
It's on the corner of Weber and Stanislaus.
Thank you both. Yeah, that's very exciting. And later when we talk a little more about it, I will put up a picture. We've got a picture of the progress so far. Thank you. So it sounds like in downtown, people can access almost any service that they might need. It sounds like almost everything can be found right here in downtown Stockton at one of your locations. So that's amazing.
Well, one of the things is we're a community health center, which means we need to be in the community. And I know in downtown Stockton, we have a lot of people that physically walk to our services.
Yes, it's so convenient, and in the vicinity of other things that they're accessing here, some of the county services and city services that are in downtown. So it's just such a good location for what you guys are doing. What issues are you seeing most often in our community, and which services do you see being most utilized by Stockton residents?
So I think in Stockton, we are consistently seeing a convergence of medical, behavioral, and social challenges that kind of all impact one another. Many of these issues affect health outcomes and extend beyond just what we do in an exam room. So some of the most common issues that we see would be chronic disease burden, particularly diabetes, hypertension, cardiovascular disease, often compounded by delay or inconsistent access to care. Obviously, behavioral health and substance use challenges and needs, including anxiety, depression, trauma-related conditions, ongoing impacts of opioid and methamphetamine use, coverage and access instability, especially disruptions tied to medical eligibility and changes. A lot of things are going on in the state of California and nationally with access to benefits under Medi-Cal. And then, social determinants of health, including housing instability, food, transportation barriers, unemployment. All of this kind of really ultimately impact health outcomes and treatment adherence. But our most utilized services kind of reflect these realities. Primary care, adult and pediatric care, including chronic disease management for prevention, integrated behavioral health, integrated being co-located with medical services, growing demand for counseling, therapy, and even psychiatric support. Women's health and prenatal care. Women's health is something that is not enough women's health providers within the city, the county, or basically our region. We also offer same-day urgent care access because not everybody can get into a scheduled visit, but would much rather see people in an urgent care setting than going to an emergency department, a high-cost area to treat non-acute medical needs. Then we also have pharmacy services, including medication support, particularly for patients managing their chronic conditions. And we have, not to get in the weeds, but a 340B program that allows us to provide discounted pharmacy medications to individuals that may not have a prescription benefit. But I guess close of one important thing to understand about community health centers is that many patients do not arrive, coming to us with just a single isolated issue. Often people that are, navigating their medical conditions. It's a complex system. Their behavioral health needs. They got a lot of economic pressures, social barriers, all kind of coming up at the same time. That's why we integrate community-based care models within our clinics, and I think that's really important to communities like Stockton.
Courtney,
Definitely.
I do have the addresses up if you want to share them. So for our channel clinic, the address is actually 747 East Channel Street. So it's very close to, and then the Adolescent Health Center is located at 701 East Weber Avenue. I also want to provide a phone number where if people want to make an appointment and get into our system, so if they can contact 209-636-5400. They can actually also text that number to make an appointment for medical services. To make an appointment for dental services, they can call 209-636-5555.
Thank you. That's very helpful. Just in case anyone listening, they need that, and this is going to help them get that care faster.
Absolutely. I think right now, I think is a very critical time. A lot of people are losing or opting out of their health care. Health insurance is rising up. And so there really is a need for a safety net, just like community medical centers, that is really designed to ensure that people have the medical and health care services that they need, as Greg mentioned, regardless of their ability to pay. Healthcare is one of the most basic necessities. I mean, our health is priceless, really. And yet, so many people have difficulty accessing it. And, when money is a barrier, that's when programs like this really show the importance to a community, to keeping a whole community healthy. It saves our system money. It saves, hospital beds and stays. And even, as when it comes to substance use, for example, it saves jail beds. Because if you are able to take someone to one of our sobering centers, for example, to help them sober up, that's one less person going to jail. For something like this. So, it's a really neat thing to have a safety net like this here in San Joaquin County, not just in Stockton, but the whole county, from Manteca to Tracy to Lodi and throughout Stockton, from north to south to central Stockton, east Stockton, everywhere.
Yes, it's so beautiful and so needed because I can only imagine what it's like for someone who's really down and out. They don't what are they going to do? They're not going to walk into a doctor's office. They're thinking, I don't have the money to pay for this. So this is really, really a wonderful resource for anyone who's in a situation like that. There is a place that you can get help for what you're going through. So thank you.
Yeah. And, one of the things I want to add too is that our facilities, they're beautiful facilities. They're well kept. And I think that's important because showing people that, they deserve that dignity, that they deserve spaces where that are comfortable, regardless of their background or whatever, that it's something, that really valuable to the community, I think.
Definitely. So we talked about the fact that most of the people who access the services they're on Medicare or Medi-Cal. Is there any other data that you can share about the people who access community medical centers services? Are there any trends you can share about who's getting care?
Yeah, so CMC serves really a broad cross section of the community, but as you mentioned, the majority of our patients are low-income individuals and families, many whom face multiple overlapping health and social challenges. But every year, we see more than 116,000 unique patients throughout our catchment area. More than 70% of those are here in San Joaquin County. But to put that really into perspective, San Joaquin County's population is around 816,000 individuals. That means that essentially 1 in 10 people in this county are likely a CMC patient already. And some of the key trends that we're seeing amongst the populations that we serve are obviously income levels. Most of the patients that we see are below 200% of the federal poverty level. Many families are obviously balancing healthcare needs along with housing, transportation, food insecurity challenges. Insurance coverage, approximately 70 to 80% of our patients rely on Medi-Cal and or Medicare. But we also serve, as mentioned, the under and uninsured with the sliding fee discount program. Race and ethnicity, our population really closely reflects Stockton's diversity, including Latino and Hispanic, Black, African American, Asian, Pacific Islanders in the community. Age distribution, we see all ages. We serve all patients from birth to death, if you will. But gender trends, we also see a slightly higher utilization among women, particularly through women's health, prenatal care, and family services and coordination.
Very interesting. Thank you. Thanks for providing that insight. So you are serving already quite a substantial percentage of the population. So that's amazing. They're providing that care. So you've talked already about, why community medical centers is such a needed thing in our community. Can you elaborate any more on what makes what you do such an important piece for San Joaquin County and for Stockton specifically? What makes CMC so important for our community?
So community health centers, I think we play a stabilizing role in communities. We provide an access point for people who might otherwise fall through the cracks of a complex healthcare system, forgoing preventative care until they're in crisis and need emergency intervention or their disease state has progressed where it's more costly. So we are here for preventive medicine and accessibility. We are the safety net in this community, ensuring that everyone has access to primary care and preventative care. But beyond healthcare itself, I think what makes CMC important is proximity and trust. We're deeply embedded in the communities that we serve. Many of our employees grew up here with CMC. Many were once patients of CMC. We understand that healthcare is ultimately relational. In public health, we often talk about social determinants of health, things like housing, food access, transportation, safety, education, even economic opportunities. So those conditions really shape health outcomes every day, and organizations like CMC really set at the intersection of those realities.
Wonderful. And Jennie, did you want to add anything? Would you like to add anything?
Well, yeah, and it's true what Greg says. We hire from our community, and our employees truly do reflect our community. They speak different languages, and I can identify with that because I myself am a former CMC patient, and so were my parents. My parents were farm workers, and that being our roots, this is where they accessed care, is at community medical centers, and early on, so did my children. So for me, it's definitely, deeply personal and rewarding that I get to give back in a community, in a system that helped me out so much. And so, yeah, I agree with Greg. We have a very passionate workforce here. They work at CMC because, they understand the mission, that our mission is to work together to improve the health and well-being of our communities, the communities we serve. And they share that mission. So, they don't work at CMC to, become rich, to make a lot of money. They come to CMC to work for a nonprofit that gives back to their community.
That's beautiful. And my last guest was someone from San Joaquin County Behavioral Health Services. So can you guys elaborate on maybe how your work is similar to the work of that organization or different from that organization?
So I'm intimately familiar with San Joaquin County Behavioral Health Services as my role, as I mentioned at the start. I served 10 years as the county's healthcare services director, and behavioral health was the largest component of that agency. So there is some overlap in the sense that both organizations are working to improve behavioral health access and strengthen the overall health of our communities. We collaborate frequently with our county partners because really no single organization can meet all community needs independently, particularly behavioral health needs that are continuing to grow. I guess the primary difference is structural and operational. San Joaquin County Behavioral Services is a county-operated public behavioral health system. CMC is a nonprofit community health center providing integrated healthcare services across primary care, behavioral health, substance use treatment, HIV prevention. So it's really, we have a combination of integrated behavioral health, whereas the county might be more directly kind of behavioral health services itself, specifically focused on mental health and not so much physical health. We also, we coordinate with care for individuals with crisis situations. We provide services more to the mild to moderate end of the spectrum, and the county is responsible, and their services are geared toward individuals in crisis and individuals with more severe and persistent mental illness. But community health centers like CMC also serve a broader role in the healthcare ecosystem than many people might realize. In addition to providing direct care, generates a lot of significant economic and public health value for the communities that we serve. As Jennie mentioned, we employ quite a few people, approximately 1,000 individuals, many right here from our community, grew up here. So, we create jobs, we support local businesses, we contribute to the local economy through activities, both direct and indirect spending. And at the same time, hopefully, we help to reduce strain on the broader healthcare system by providing accessible, preventive, and cost-effective care before, like I mentioned, before issues escalate to emergencies and potential hospitalizations. So nationally and statewide, I think studies consistently show that Medicaid patients, Medi-Cal here in California, who are receiving their care through health centers experience lower overall healthcare costs. CMC's cost of care is approximately 22% lower compared to other healthcare settings. And overall, I think this is 2024 data. Our contribution represents about a $250 million in savings to Medicaid and the overall healthcare system. So I think that's a really important point because community health centers are not simply providers of care for vulnerable populations, but all that's central to our mission. I think we also are kind of a stabilizing institution that is helping to improve public health outcomes, strengthening workforce participation, and contribute to the overall health and economic resilience of communities that we're embedded in overall.
Thank you. Thank you for kind of touching on some similarities, but also large differences between what you provide versus what BHS provides.
I also want to add, Chris.
Can
I just because Greg has such an extensive background in healthcare, and having come from the from the county, he. I just wanted to kind of ask to kind of share how we've also worked together, because he was in that position where working from the county. He worked together with CMC at the time. So just wanted to ask can I ask a question? If we can share how we've collaborated, as a system, as a whole system, because it's not necessarily, a competition. We all work together, and I think that's one of the wonderful things here in San Joaquin County, because so many nonprofits, so many organizations and agencies really work together. They come together and work together to respond to the community's needs. So if I may ask to share some of the collaborations.
Yes, definitely. Did you want to share more about that? Do you have maybe some stories that you want to share?
Well, I could tell a little bit about,
okay.
Between healthcare services, the county and CMC, there's been some longstanding partnerships. There's more need in the community for the people we serve than there's really capacity at times. But the county was supportive with CMC with the establishment of whole person care programs that was the precursor to CalAIM, which was the redesign of Medi-Cal about 4 or 5 years ago. The county partnered with CMC with a Prop 47 grant that established a sobering center that eventually became our respite center and an ability to treat people who are making that critical life change and want to enter into substance use treatment services. Partnerships with public health on the treatment of chronic disease and illness, specifically tuberculosis. So I think some longstanding, and it's not a competition, it's more of a co-opetition where we don't want to be duplicating services. We want to be communicating, aligning, and making sure that ultimately public and private funds are spent efficiently and effectively.
Makes perfect sense. Maybe connecting people, maybe they're connecting people with you, maybe you're connecting people with them. Kind of depends on what the needs are and what each organization can provide. That's beautiful collaboration in the community. So you've talked a lot about what CMC offers, and it's very interesting to know about your services and who can access them. What is something that you think people might be surprised to know about community medical centers?
We have some good stories to tell. I don't think people always realize what we do in the community. Most of our, we kind of reconnect people back to healthcare, stabilizing. They've had fragmented or untreated behavioral health conditions or medical needs. And I don't know if you want me to go into storytelling here, because I know we kind of thought about two different stories that are kind of compelling of what we do that are we're not just treatment. We are, I guess to get into one of the stories really speaks to the the importance of preventative care, and it involves a young girl who came to CMC for what was supposed to be just a routine sports physical, but during the exam, one of our pediatricians noticed an irregular heartbeat and referred her for additional testing, and ultimately that led to a diagnosis of Marfan syndrome. Something you're not really going to hear about, but it's a serious genetic condition that might otherwise have, if it had gone untreated, it could have become life-threatening. But the family member learned that there was a history of this condition in the family that they did not fully understand, including the loss of another child of sudden cardiac arrest. So because it was caught early, this young girl is now receiving treatment and monitoring that will allow her to live hopefully a much healthier and longer life. So to me, that story kind of reminds that the community healthcare is not about treating illness. It's sometimes about catching something early enough to completely change the trajectory of somebody's life. Then kind of a second story that kind of sticks with me is involves a mother who brought their teenage son to CMC after he was bullied at school and struggled emotionally. Yeah, he was on the autism spectrum, and she said that finding behavioral support elsewhere was really difficult and overwhelming. So here at CMC, he built a strong relationship with one of our counselors, and what really struck me was after a while he started reminding his mom not to forget about his appointments. So he wanted to come back and be engaged. So to me, that's really what community health is about. It's creating spaces where people feel safe, supported, and willing to ask and come for help. And collectively, we can help them address challenges before they become crisis.
Beautiful, beautiful examples about how just going in for one visit, because maybe she wasn't, if she hadn't been able to access any care, would she ever have found out that she had that condition? Probably not. So it's really cool that she was able to get that information from CMC. And in the second example, that's really, really awesome and a testament to the care that he's receiving, that he wants to go back. It's not like, Mom, no. It's like, no, it's my appointment time. Like, let's go. That's very cool. Very cool. Jennie, do you have any stories that you also want to share? You kind of were talking about your own story, which is another testament to CMC, just from your parents and your own children having services there. But are there any other stories that you'd like to share?
Yeah. So when I first joined CMC, it wasn't long after that the pandemic hit. And to me, what stood out is how quickly CMC jumped into action into working with our community partners to respond. And so our staff really became, my heroes, certainly heroes to the community to, get out there in the front lines. And, it was, we had a lot of support from like funders who came forward, such as, different funders, the county, Valley Strong Community Bank. At the time, it was Financial Center Credit Union, I believe. But these organizations that wanted to give back and make sure that our community responded properly. So we had a team of individuals through our Care Link program that showed up literally every single day, Monday through Sunday, 7 days a week, every day, to local shelters to help screen individuals, to contain the situation and make sure that we would avoid, a catastrophic situation. So being able to also help individuals to isolate. And so being part of that whole system, I think it was something that is going to forever be memorable to me, because we were able to come together as a community and to have CMC be a key part of that, I think was, definitely something that is always going to stick in my mind, and that I got to be part of that as well. So that was something. And, Care Link just does always have like a special place in my heart, just because I love how our teams go out there and support our shelters and go to the encampment locations fearlessly. And so I remember one situation where they came across a woman who had been, and this was during the pandemic as well. She had been stuck. It was in an encampment.
Mm.
Her vehicle, because she was living in her vehicle, was stuck in like a ditch and like a muddy, area, and she couldn't get out. And she also was very ill, so she could have passed away, sadly, and no one would have found out until days later, until it was too late. Luckily, our team was out there and they were able to help her to get help, to assist with with responders, so that they can extract her out of that place and she can get the help that she needed. So it's situations like that that are not the typical clinical situation, but we have our everyday situations, but we also have these just extraordinary occasions where, had we not, had that program in place, had we not been able to, put these different pieces together that we do in response to the community's needs, then, these situations could have been worse. So those are the types of situations that also stand out to me.
Thank you. Yeah, what a testament to CMC to just jump in during the pandemic when, we really needed help all across the world. Someone had to do that work of screening, and how great that CMC is one of those organizations that jumped in and was able to provide that. So that's beautiful. And then talking about your Care Link program, and that's amazing that the woman was able to, get the help she needed to get out of that situation. And can you just elaborate a little bit more on Care Link and what that is, just in case people don't know? Can you tell us a little bit more about it?
So Care Link is a mobile healthcare unit, and it is funded by different sources, because it's not a program, it's not a service where we can always bill. So this is the type of program where we need community support, and we have different partners that help us to make sure that this program keeps going, such as Sutter Health. They're one of our funders. Who else has been? I don't want to leave anyone out. I know the county has also provided us funding for it. Health Plan of San Joaquin, various
Stockton.
community. I'm sorry, the city of Stockton. Yes, the city of Stockton. So various partnerships that have come together to ensure that a program like this keeps going. And so our mobile unit goes out to different encampments throughout the county, including Lodi, Stockton, Tracy, Manteca. And so they go to encampments. They also go to certain shelters or certain centers, like community centers, to be that reliable source, so that we can meet people where they are. And that's really important with when you speak of individuals who have that sort of instability. For individuals who are experiencing homelessness, that health, unfortunately, is not always their first concern, because they are in survival mode. And so they let, unfortunately, things kind of, their health go by the wayside. They might have, an oozing wound. I'm sorry, I don't mean to be graphic, but this is reality. They might have, an infection. They might have untreated diabetes. And so these situations, they escalate really quickly if we don't get to them, and so that's why these types of programs are really important. It's important to meet people where they are sometimes.
That's beautiful. If I can ask, is there a number that someone could call if they feel like maybe they've seen an encampment and that could use something like this? Or, how do you plan where this mobile unit will go?
So they're not a unit that responds to calls necessarily, because they do have a set schedule of where they go. They go to certain encampments, and they do have a schedule. So I believe that they do post it on social media. But they have a certain schedule. They do go to certain shelters. So they have these agreements to go to these shelters, not like paid agreements, but they're, just sort of informal agreements that they go to these places. So they've come to be a reliable part of those locations. And so people kind of, they know where to go. But certainly if someone does need more information, I can get that number for you. So,
okay. Yeah.
I'll go on
Thank
my
you.
computer here and look for
Yeah.
good contact information.
It is a lot more tilted towards partnerships with shelters, municipal partners, faith-based entities. If we're going out into the sloughs and the unhoused, it's really more in collaboration with other partners rather than us independently.
Okay. Yeah. Thank you. That's really good to know, and what an amazing service that you guys provide this. It's just amazing. So whenever you get the number, I'll pop it up. No worries.
Yeah, and we don't have like a Care Link phone number, but say if someone wants to connect to the program, I could get you an email, for example, to kind of and see how, how that could how they can arrange something. But they do have a set schedule of places, and if someone maybe needs the schedule or something like that, I can I'll gather that email for you.
Thank you. So each of you, so we have the CEO on the line and we have the Director of Development. And I would like to ask both of you, what are your primary goals for your time in your position? What are your main areas of focus? What are you trying to do? Like, what kind of legacy do you each want to leave behind?
So my primary is really ensuring that CMC remains stable. I commonly say no margin, no mission, but ultimately we're mission driven. Mission comes first, but we need to make sure that we're sustainable and really to be responsive to the evolving needs of the community that we're a part of. And obviously, healthcare is changing rapidly. State and nationally, organizations like CMC are navigating workforce challenges, reimbursement pressure, rising operational costs, and really simultaneously a growing need for our services. So our responsibility is to ensure that we continue to adapt thoughtfully while remaining grounded in our mission. By being able to make our budget ends meet, we can sustain our services to the vulnerable population that we serve. We can sustain our employment base as well. And I care deeply about our organizational culture, about leadership development. Healthcare is ultimately a people-centered work. Supporting our employees, building strong teams, maintaining clarity of our purpose, I think, is essential to what we do to serve our community over the long term. But ultimately, my role is to empower our teams to act, to make sure that they have the services, the resources, the communication, everything they need. I'm not a direct caregiver, but my role is to enable our teams to provide the care to our communities.
Beautiful. Well said. So you're really focused on just making sure CMC is stable and also able to provide the best care that is possible, providing all of your workers with the resources that they need to execute and provide this important service to our community. Beautiful. And Jennie, how about you?
So for me, it is deeply personal because, like I said, I grew up in this community, And I was once a CMC patient, so I can identify with our patients and the needs of our community. And so, even when I was a journalist, I recall covering some of the cases that were really, heart-wrenching and a lot of preventable situations. And so, at that time, I really wasn't able to be part of any solution, because you kind of have to remain, not kind of, you do have to remain unbiased and really objective, and so you can't really get too involved in certain efforts, especially the ones that you're covering. So I wanted to be part of something that made change, that created change, and I think I found that in CMC, that I like Greg, I don't work directly with patients, but the work that I do contributes to bettering the community. And so being able to kind of utilize any kind of skills that I have towards that mission, I think that that's satisfying to me. But as far as my role with the community, with CMC, as development director, my goal is to build up our donor base. I think just in general, nonprofits are in a position where grant funding isn't as available as it used to be, vastly. Luckily, CMC does have, Medi-Cal revenue, but we still require some additional support to run programs such as Care Link, and to launch and to complete programs such as the Adolescent Health Center. So while we have grant funds, that situation is really changing for a lot of nonprofits. There isn't a lot of federal funding available at the time. It's a trickle-down effect. There isn't a lot of grant state funding available as well. And so as a result, there's a lot of competition for foundation funding or for private funding. And so it's a challenge. And for CMC, it's a challenge to ensure that we continue providing these vital programs that are not supported by Medi-Cal dollars, because they extend beyond a medical encounter. They involve building community trust. So going out, doing outreach, doing these touch points, helping someone out with, giving them, clothes or a hygiene kit, things like that have to do with building trust, or going to a community health fair and having a tabling event there so that we can enroll people on Medi-Cal, things like that that are not necessarily covered by Medi-Cal, but that we do to provide extra supportive services and address what we call social determinants of health. So address other parts of a person's life to make sure that they are healthy. So these things, they happen because of community support, because of donors, because of partners, corporations, companies who want to come forward, and they have a priority of giving back to their community, and they have a priority of also, making sure that their community is healthy. And so when that aligns with CMC's mission, I'm looking for those partners who want to work together to improve, just like our mission says, to improve the health and well-being of our community. So that's my goal. That's my mission, is to build up our donor base, to build up our development department so that we can continue doing some of the work that is very vital to our community.
Thank you. So let's go ahead and talk about your funding then, since you just talked a lot about it. Right now, how is CMC primarily funded? Is it mostly donors?
Oh, no. We primarily, we're unique, and FQHC has what's called a prospective payment system. So we're not traditional where we get we bill line item billing. It's PPS, prospective payment systems, kind of a quasi cost-based reimbursement. So when we see a Medi-Cal member, we get a PPS rate, which is a rate that is established on a per clinic basis. But, costs go up and our rates do not go up. But that is the bulk of our reimbursement for both Medicare and Medi-Cal. We have some very limited Medicare Advantage plans. But then beyond that, we have the sliding fee discount program. We get some direct funding from the federal government, the Health Resources Services Administration. We have grants for providing services to homeless individuals, migrant farm workers, and individuals with HIV or AIDS. But primarily our revenue is based upon visit volume.
Okay, so you are getting paid for the services you're providing, and that's kind of really helping to fund the organization.
So for probably 80-90% of what we do, we get reimbursement. But for the people that do not have insurance or do not have adequate insurance, they might come to us and get a sliding fee discount. May or may not pay us $10 as a copay. That's well below cost. So a good percentage of our business, things have been good since 2014 with the Affordable Care Act and the expansion of coverage within California for the undocumented population. But we're facing some challenges. Right now, tomorrow, the governor's May revise will come out, and we're looking to see if they are going to push out for another 18 months, something that's going to happen starting July 1st. July 1st, the state terms this the unsatisfactory immigration status. So to you and I, it's probably individuals that are undocumented. They've been afforded state-only Medi-Cal over 3 rounds. Initially was 0 through 18, then 55 and above. But last couple of years, there's been state-only Medi-Cal for that entire undocumented population. Given what's happened at the federal level, but also more so state budget and general fund, starting in July, when I mentioned that prospective payment system rate, which is a kind of quasi cost-based reimbursement, we will not get that for that population. We still have a mandate to serve them, but realistically, that might be a loss of about $10 million per year for us as far as gross revenue. So we definitely have some upcoming revenue and fiscal challenges, but that also, every other FQ, in our county, that's SJ Health, which is the county's a lookalike FQHC, Golden Valley, up and down the state, we are all facing this cliff that's coming up, and ultimately waiting to see what happens with the May revise, but ultimately on or before June 15th, when the state is mandated to provide a balanced budget. Are these issues that were enacted last year with the state budget, are they going to come to fruition or not?
Wow, very interesting. Oh, go ahead, Jennie.
I'd like to add to that despite the revenue reductions that we're going to see, it's not going to reduce the need for healthcare. In fact, it might, escalate it. So being, as Greg mentioned, being that we are a safety net in this community, we can't turn people away. So there is still a need for continued support. And so that is why we still fundraise and we still seek grants, because as Greg mentioned, not everyone has insurance, and that number will grow of uninsured people. And to prevent these situations from going to the hospital, you need primary care. You need a healthy primary care system. But beyond that, there are services that are conducted that are not always Medi-Cal reimbursed or Medicare reimbursed, such as I mentioned, the Care Link activities. or enrolling people on Medi-Cal, a capital needs. There's equipment that breaks, that unfortunately there's a life to each piece of equipment. So there's equipment that needs to continuously be exchanged or replaced. And so for a system that serves more than 100,000 people in this community, you can see why these are important needs.
100%. So on this topic, does CMC accept donations? I know you were talking about increasing your donor base. Can you talk a little bit more about that? Or maybe how could someone give to your organization? Is that possible?
Absolutely. They can give any amount. No amount is too small. If we have reoccurring payments, if they want to sign up, and they can do it online. If they want to sign up to give $1 a month, all these small amounts add up. So we have a system. So if they go onto our website to cmcenters.org, there is a button that says donate. And if you go up to the menu, there's a link there. There's also another page that they can click on. It's called Support CMC. So they can find different ways that they can support CMC. We have a donor tier program where if they give, this level or that level or that level, there's certain benefits that come with that, such as being part of a like a state of CMC, event where they get to hear what's going on with CMC. They get to know where their dollars are going. We have our capital campaign that we launched for our adolescent health center. And for that, there's an opportunity to be part of our donor wall. They can give anywhere from 1,000 to up to 10,000 to be part of that wall. And it could be split up into monthly payments as well. So if they want to split up that $1,000 into monthly payments, it's a little over $100 a month. So we have those opportunities. As part of that capital campaign, we are also we have naming opportunities. So if someone wants to name, for example, the quiet space, we have a room. We have these rooms that are quiet spaces for people who have perhaps like some auditory triggers. Individuals who may be like on the spectrum, or individuals who are maybe going through who've been triggered with a trauma, and they need to be in a quiet space. That's a room that they can go to. So they can name that. They can name the basketball court, different spaces and areas like that. So it's a way to build a family legacy, for example, or to recognize a company. If a local restaurant wants to show that they have been a part of supporting the building this unique adolescent health center, that's a way to do it. The adolescent, so I don't want to get ahead of myself because I know we're going to talk about it later. That's a question that you have coming up, right? About the adolescent.
Yeah, it's coming up soon. Yeah. Definitely.
So I'm not going to go into it. I know Greg wants to talk about it too. So, but those are some opportunities. But like I said, no gift is too small. And so if they go to cmcenters.org, that's one way. They can also contact me directly, and we could set something up, a legacy gift. You could even give stocks. You could give, you could name us in part of your estate planning. There's different ways to give back. So they can contact me at jrmoore at cmcenters.org or 209-373-2454.
Awesome. Thank you for kind of outlining some opportunities for the community to donate, to give something towards CMC, really to contribute to what you guys are doing for our community. It's a beautiful opportunity. So if anyone's listening and maybe you're interested, please reach out to Jennie or visit their website to donate to CMC and the beautiful work they're doing. All right, so we are coming down towards the last little stretch of my questions, so I'll try to get through these. What is the most common question that each of you are asked in your position? And how do you answer it usually?
I guess for me, it's probably some version of how do we continue to meeting the growing needs of our community in this difficult environment. I know I kind of got off into the little bit of the weeds there with how we get funded, but we are, along with a lot of the other safety net, are facing challenges. And the answer, I guess, really requires constant adaptation, disciplined stewardship of our resources. I think part of the dialogue today is really strong partnerships and ultimately staying grounded on our mission. Community health organizations have to be both compassionate and operationally disciplined at the same time, because our goal is to continue to provide services to our communities going forward, day in and day out. CMC is going to weather this storm.
Beautiful. And Jennie?
I still get asked what CMC does. I think because I'm out there in the business community a lot, and I think if you're not a Medi-Cal patient, you don't always know that this is an option for you, and so even if you are a small business owner, a small business startup, or you have employees who don't have insurance, this is, or who are on Medi-Cal, this is a place where people can go and they have access to a sliding fee scale. So they can pay a nominal fee for their visit and still receive quality care. So I think just, being able to spread the message that CMC is here for the community to provide quality care, and that there's a place for people.
Beautiful. And what do each of you love about the work that you do?
I think ultimately it's touching people. Unquestionably, it's the mission that we do. Community health attracts people who, I think, as Jennie mentioned, generally care about others, who believe healthcare should be accessible and compassionate. Personally, I'm a servant leader. I believe that my duty is to take care of our neighbors in need. I don't look down upon any individual unless I'm trying to lift them up, and I appreciate the resilience of this organization. Community healthcare is not easy. The challenges are real, but I think I'm really continue to be inspired by our employees who show up each and every day committed to serving our patients with dignity and respect. And ultimately, we're here to provide high quality, compassionate care to all of those in need.
Love it. Love the answer. And Jennie?
What was the question? I'm sorry.
I was just asking, what do you love about the work that you do with CMC?
I love the mission. I've not always necessarily been a fundraiser per se. That's not always been my background. As I said, I was a writer. And so, but I think the fact that I'm working toward this mission because we have to believe in what we do in order to, to promote it and spread the message about it. And for me, I think that's what keeps me going, is knowing that the work that I'm doing, I'm not asking for money for myself. This is, right. I'm looking to fill a need. And so that's it's important to me.
Thank you. Thank you both. So are there any new programs or services that CMC will be releasing this year?
Yeah, and I think one of the most significant really is, which is underway. It's under construction. Again, it'll be hopefully completed construction come November. But it's CMC The Rock. It's our adolescent health center right in downtown Stockton. I mentioned before. It's being designed specific for teens and youth ages 18 to 25. Transitional age youth is kind of the term that's used, but it's going to include medical care, behavioral services, prevention programs, and supportive services really tailored to that age group. The first floor is more medical, the second floor is more social, if you will. But it's really where young people, who face barriers to care, especially around behavioral health, or we need to provide early intervention services, and believe that creating this youth-focused healthcare environment is going to be critically important to changing the trajectory of many lives. But it's something that's been a long work in progress, but I see the light at the end of the tunnel. In another few months, we'll have some ribbon cutting. Thank you for the picture.
Amazing. So work in progress, under construction. And you said it's going to be open in November. Is that right?
Construction will be completed by then. We have a complex environment as far as licensing, but it should be open to services before the end of this calendar year. But construction, then temporary occupancy permits, other things. It is a 110-year-old building with the basement, so we've had some construction challenges.
Understandable, for sure, especially downtown. That's very exciting. I can't wait for it to open. Amazing. And so your organization, it's called Community Medical Centers. How do you go out and get involved in the community?
Well, I think, Jennie's work, we have a lot of ambassadors, but, community engagement is really foundational to our work. We partner with schools, nonprofits, faith-based organizations, healthcare providers, local government agencies, and community coalitions throughout the agency. It's really about partnerships. We participate in outreach events, as Jennie mentioned. We have prevention campaigns, advocacy efforts focused on improving community health, social media. So you will see us out in the community, but it takes partnerships. And I know when I was at the county, part of my role there was being a convener to build those collaborations. So we have myself and members of our team have a lot of connections with the community that we need to foster and grow.
Beautiful. Beautiful. And is CMC currently hiring or accepting volunteers?
We definitely are hiring, specifically in clinic-facing roles. Front desk, medical assistants, people that are within our clinics. I mentioned some of our fiscal challenges, but we definitely are hiring. I think it's true that we're literally the third largest nonprofit in the county. People might not realize that St. Joseph's Medical Center and UOP are also nonprofits, obviously larger than us, but we're not going anywhere. We hire across a range of clinical, behavioral health, administrative, and support roles. Anybody interested, on our website, cmccenters.org/careers, I think it is. You can look at what we have posted there for job opportunities. We really promote career ladders. There's so many employees that have been with CMC 20, 30, even 40 years, grew up with us, and really promote starting a career with us, growing with us. But we also have volunteer opportunities and community engagement opportunities. And I know you'll see on our social media other posts with events and flyers, but I think also follow us on social media to look for these opportunities. And I believe our handle there is CM Centers.
Let me go ahead and pop that up. Beautiful. Thank you. So yeah, if anyone is interested in finding a job or a volunteer opportunity, please check it out. Check out their website. I was looking over it. There's a lot of positions available. Go ahead, Jennie. You were going to say something?
I was going to say that I love volunteers. Well, a lot of what I do needs volunteers. So if anyone is interested in helping, I work with volunteers for our annual fundraiser. We hold an annual fundraiser, a gala, and so it's a beautiful event where you have an auction and we fundraise. So I always need volunteers to help me work that event. We have other events. We have our National Health Center week coming up, so we could use volunteers in that area. So we have a youth advisory committee that advises us on the youth services as well as our adolescent health center, the Rock building that we're building. And they also help with some outreach and things like that. So if there are youth or really of any age who want to help, they could always contact me to be part of an event or part of the youth advisory committee.
Beautiful. That's a lot of opportunities. A lot of opportunities to get involved, give your time. If you can't give any monetary contribution, at least you can maybe come out to an event, give your time, help CMC. Thank you. All right, my last little bit of questions are about downtown Stockton specifically. We talked about the Rock and how you guys are developing that. Can you tell us just maybe more about who might be accessing the services there and who that's really for youth? Is it just all types of youth services that they'll be able to access?
So it's really that integrated healthcare and supportive services for that transitional age youth population, individuals age 13 to 25. We're providing primary care, behavioral health education, prevention, and youth-centered programming. Jennie mentioned we have a youth advisory council really to engage our youth on the programming and what we're doing there. But I think this is a much-needed center. Our communities experienced disparities in access to behavioral health services for adolescents for a long time. I think it's critical that we, as a community, provide early interventions for the young people before the issues follow them into adulthood. If we can provide early substance use treatment, we can avoid someone becoming dependent on drugs. If we address childhood experience earlier with trauma-informed care, we can hopefully prevent, build resilience and avoid problems that might surface later in life. But the vision is really to create a welcoming environment, and it's been specifically designed around the realities and needs of adolescents and young adults.
So needed in our community. It's so exciting. What impact have you seen community medical centers, programs, and services have on the downtown Stockton community specifically, if any?
So I think CMC has contributed to downtown Stockton both through our healthcare access as well as through our investments in community infrastructure. As you saw, we have several facilities kind of in close location there at Stanislaus and Weber area. We ultimately are looking to rebuild our Channel campus into a flagship facility. That, as I mentioned, we have the St. Joseph's Medical Center Family Medicine Residency Program. But ultimately, we need to be in the community, and I think we know that if we build it, they will come. So that's still an aspirational goal. This would be a $50 million project or more, but we're looking to see how we can move funding with design and ultimately into construction in the coming years. But healthcare organizations, we serve as anchor institutions. When you create stable community-centered services in the downtown area, hopefully you increase access, foot traffic, employment opportunities, and long-term investment and revitalization of Stockton's downtown core. So as mentioned, we have 5 existing sites in downtown. And the new project that we've been highlighting on today, that CMC Rock, are examples of really a healthcare investment aligned with broader community revitalization.
And if ask anyone about CMC, a lot of people will say Channel Medical Center and that is there in the heart of downtown Stockton.
Yes.
Our Channel Medical Center, or CMC Channel, has been a cornerstone of our community, and so it's a place where people know they can go.
Yes. So as you're talking, CMC has invested so much into downtown Stockton. You own several properties here. You're working on this new youth center, but you already have existing offices. And we really appreciate that. It really is helping to revitalize downtown. And I want to ask, what do you love about downtown Stockton? Each of you.
I'd say downtown Stockton, it's got character. It's got a history. Hopefully we're building resilience. It's authentic. And I think there's a strong sense of community, but also I really enjoy the cultural diversity within the city of Stockton and downtown. But I also think people underestimate the amount of creativity, entrepreneurship, and even civic commitment that exists here in Stockton. Stockton might have a bad rap, but I think Stockton ultimately it is a place that is up and coming, again being revitalized. But there's individuals and organizations working hard every day to improve our community, and I think it takes dialogue like we're having today, and really promoting all of the positives that the positive opportunities. I'm an optimist. There's a lot of opportunities for the city of Stockton and definitely downtown Stockton.
100%. 100% agree with you. What about you, Jennie?
Well, being a lifelong, I was born and raised here in this community. I remember walking downtown to, go to Rosenthal's or Newberry's, and it was kind of the place to be, in the 80s and maybe early 90s. I'm sure before that, that was kind of my era. So it's a little bit nostalgic, when you think of downtown. But it's just the fact that we're able to be part of its continued growth and revitalization. We don't want to certainly ever let our downtown go. And so I definitely, it's wonderful to see all these new businesses pop up, and to continue to make it a place, a destination, like our some of the restaurants downtown, FED or Fed. I'm not sure how you pronounce it, but there are some there are some great restaurants downtown. We have our movie theater. We have our event center. So there's wonderful community events downtown. Of course, we have CMC. Shameless plugs, all day long, but we just, all these businesses really support keeping downtown Stockton alive, and its heritage, its legacy are the beautiful buildings downtown, historic buildings. It's important to keep all that going.
Thank you. And so my next question I always ask is about lunch spots, and you mentioned the Fed, so that's got to be one of your favorites. Greg, do you have one or two favorites you want to give a shout out to?
Well, when working for the county, I was always downtown with going to the county admin building, so a little less frequently coming downtown. But there's cast iron trading, Nina's Mexican cuisine. But unfortunately, I try to support our local businesses whenever possible. But most of my day is grabbing lunch whenever I can, and then commonly that's at my desk.
There you go. Yeah, you're working hard, but good shout outs, good choices, you guys. Okay, so my very last question is, how can people get in touch with each of you to ask questions, access services, or learn more about what you're doing?
So I think ultimately we have a good website, social media. contact our central scheduling, our central number. I have kind of an open door policy. What I don't know, I can't address, but however I can build partnerships in the community where the community can come together to address needs. Reach out, if you want more information. Our specific email address for that is info@cmcenters.org.
Thank you. Let me get
And
that up there.
And my email address, if anyone wants to get in touch with me, either for volunteer opportunities or for a partnership, they can email me at jrmoore, JRMOORE @cmcenters.org.
Beautiful. Thank you. Thank you both for answering all of my questions. I know that was a lot and we got through them all, so I appreciate it. And let's just see if there are any audience questions. Okay. Just give them a chance. And while we're waiting to see if there are any, I do want to remind everyone that this video has been streaming live to YouTube and LinkedIn, where we are at downtown Stockton. It looks like the Facebook link had a little error, so we'll have to repost to Facebook later. But please, like, subscribe, share the video with anyone who you think might get a benefit from hearing this information about community medical centers, or just someone who's interested in learning more information about the organizations in our community. So please share the video. All right, let's see if we've got any audience questions. I don't see any at the moment. So what I will do is I would like to ask each of you, is there anything else that you would like people to know about CMC or the work that you do before we close out?
Yes, I just want to remind people that hopefully they understand that community health is fundamentally about dignity. There's dignity in every human life, and we are here to honor and uplift that. At the end of the day, healthcare is not simply about treating illness. It's about helping people live a healthier, more stable, and hopefully hopeful lives. Community health centers exist because community health benefits everybody, socially, economically, and morally. The work matters deeply, especially for communities like ours that have some significant challenges. So what we're seeing in Stockton is not simply a healthcare issue. It's a convergence of medical, behavioral, and social economic challenges. As a federally qualified healthcare center, our responsibility is to meet patients where they're at and provide comprehensive and integrated care. We recognize that the healthcare systems can really be difficult to navigate, especially when you got a lot of other issues in your life that you're addressing. So we hope to reduce barriers and increase access to care. The demands for our services continue to grow. We're addressing both clinical needs as well as the broader conditions that influence health and outcomes within our communities. So I think FQHC's community health centers have a very good story to tell. And with that, maybe turn it over to Jennie.
I think I did forget to mention this, that we do partner with businesses who want to be part of our giving strategy. So if maybe a local business downtown or really anywhere that wants to partner with us on sort of like an employee giving program, we have that option as well, where they can match or help do like a payroll kind of a deduction type of a thing. We can help and work with them on a program like that as a way to giving back to their community, and being part of the local strategy to make our community healthy, and make sure that we because our community's health is all of our is in the best interest of all of us, right? To have a good and healthy community. So if that aligns with their priorities, I'm happy to work with different businesses, whether it's maybe, donating a gift basket or a gift certificate that we can auction off, or, setting up like an employee giving program. So Just want to offer those opportunities. But yeah, I echo everything that Greg said. I mean, we're here to be part of the community's solution to provide and ensure that people have the health care that they need.
Beautifully said. Thank you both so much for your time today. Thank you for explaining more about CMC, what you guys do, and really kind of showing us how you're here for our community in so many ways. I want to say thank you for the work you're doing. It's very important. It's very needed. So thank you so much for everything. And thanks for your time. So with that, I will just say also thank you, viewers, for tuning in. I hope you learned something about CMC and the cool things they're doing here in the downtown Stockton community. So with that, I'll just say thanks, everybody, and have a great day downtown.
Thank you, Courtney. Thank you, everyone.